Hi, I'm Trevor with Trevor and Jill Talk. Today we're with Emma Robinson and we're going to be talking about EPAT.
Yes.
For
Cellulite. So EPAT's a treatment for cellulite, although it's not directly affecting the cellulite. It's affecting the connective tissue and tightening things up, but I just wanted to show an example of how it works. We also use EPAT for joint pain, plantar fasciitis, so there's a lot of uses for it, which is great. So I start just by putting a little bit of gel on.
We're with Carrie, by the way. Thank you
Actually,
for being
Carrie looks excited here.
We want to know how much it hurts.
So basically what we do is we target the areas where there's the most cellulite. Obviously Carrie's pretty good, but we're just going to show you how it works. You start with the sound waves. It's going to be 9,000 sound waves, and basically I'm doing light pressure and I'm moving the handpiece upwards in the flow of the lymphatic system. The treatment itself takes approximately 20 to 30 minutes for both sides, and it's twice a week for 8 weeks. Treatment for joint pain, things like that, is much shorter. It's usually about 5 treatments, and they go about 10 minutes long. So there's just the impact of the actual sound waves going in. And you're doing okay?
I'm fine. And can you use this to treat cellulite in any spot on your body, or is it more effective on the thigh?
It's great for thighs, arms, things like that, for sure. You know, it's just there is a treatment for the abdomen, although I'm not crazy about that, just because it's a little bit more sensitive. I find it more effective for sure legs
One
and arms.
piece. One piece.
Yes.
There's so many good ones.
Would you want to do one thing at a time? You don't want to do your whole body at once?
I do recommend. Yeah, definitely recommend, because the idea is you're creating inflammation during the treatment. So you don't want to spread your resources too thin. You want your body to focus on the areas that you're working. One of the caveats with it is that during the treatment cycle, we ask you, unless you're taking it for a medical reason, but to avoid NSAIDs like aspirin, Motrin, Advil. Tylenol's okay. Just because
is there downtime here?
There's a little discomfort during the treatment, but typically people are fine the next day. Yeah, not a lot. Sometimes with the pain treatments, they can be a little bit sore just from the inflammation, but that tends to ease up very quickly.
You know, does Carrie do any sports? Would this affect her and any of the things she might be doing, like play tennis?
Yeah, I always, for patients, the big thing is not, is to avoid elective things if you can the first couple days afterwards. You don't want to overuse anything, but you can go about your normal day-to-day activities. That's
wonderful.
fine.
Sometimes it's good to give yourself an excuse to settle down.
Don't go to the gym.
Take it easy.
Only this time.
Give yourself
Exactly.
permission. Great.